Hey guys, my name is Gabby. Well, that's what most people call me, I should say. My name is actually Gabrielle. Um, I thought I'd make a video on sort of my backstory and the effects of prednisone because I know a lot of people take this drug. It's overused at some points, and I just wanted to give my story, who I am, and why I take it, and how long I've been taking it, and what it's done for me, good and bad. So, I was born on December 21st, 1998. Now you guys can do the math and see how old I am. I'm not that old. And, didn't take long for them to find out something was wrong with my eyes, as you can see now. Sorry that it looks like I have dark circles under them. I'm really not that tired. But I thought I'd have my glasses off to show you guys. This eye is completely clouded over by this point now. Anyway, so by day 4, I was sent to Vancouver, BC Children's Hospital, which is Christmas Day, and they diagnosed me over time with Peter's Anomaly and Aniridia. Aniridia is basically the loss of pigment in an eye, and I'll post the terms and the description later on, but there is a specific scientific term for when your eye twitches. I've seen it before because I like researching my stuff for fun. Anyway, so yeah, it twitches a lot and it annoys a lot of people and weirds them out. They tell me straight up, which is kind of rude, but you know, whatever, you live with it. And Peter's Anomaly has to do with your cornea. Like Aniridia affects it too, but in my case, Peter's Anomaly was the main contributor for its defects, and Aniridia just was a catalyst to that. So it also gives you glaucoma, so that's the third thing I have, but I'll define that in a second. Peter's Anomaly means, actually it can cause two things. So first off, it deals with the cornea, and it causes the cornea to get cloudier, and that's the main gist of it. There's like all these scientific terms for it. I can even share a link to an article if I can figure out how to do that with copyright stuff. That can give you all those terms, but I wanted to make this sort of understandable for people. And I have bilateral, which means two eyes have it for all three of those conditions. And yeah, it also gives glaucoma, and it can affect your kidneys, and yeah, just your kidneys. So for the first 5 years of my life, or more, actually more than that, I was tested all the time on my levels, especially my kidney ones. I still am to this day, but their main focus then was definitely how are my kidneys reacting to this eye condition. Is it gonna give me this kidney disease or not? I'll elaborate more on the kidney tests and whatnot later. And then the final thing, fortunately I didn't get that. I'm lucky. It's just my eyes I'm affected with. And it can also affect you mentally, but there's rare cases of people with mental conditions with Peter's Anomaly. Well, Peter's Anomaly itself is rare. And glaucoma has to deal with your eye pressure. You can either get under pressure, a very low pressure, and a very high pressure. Now, most people think if I have a high pressure, that must mean my eye isn't healthy and stuff. It's not always the case, actually. There are some people who always have a certain eye pressure, like maybe 20, 21, or 22, and that's fine. Or maybe their eye pressure is always 3 to 5 or something, and that's fine. But it all depends on the patient, and you should always consult a doctor and not just Google on this stuff. So my issue had to do more with the high eye pressure, though, with the glaucoma. So starting at 5 months old, I had my first corneal transplant, and I've had 11 of them since. And I've also had a dozen or more other surgeries on my eyes dealing with glaucoma and the transplants and such, removing of stitches, putting a valve in each eye, patching the valve, and the valve has been taken out of both eyes now, but in my left eye it's had to be replaced once because it still has sight, so the pressure is still affecting it. But in my right eye, I lost vision at 18 months because on its 5th transplant, between 5 and 18 months, it kept rejecting, and this one just got an infection. Like, there's literally just stuff growing on the eye. It's kind of creepy. I won't get into it. And so that rejected and got infected, and the doctor just said, get rid of the infection and just let the eye be. So they treated that, made sure the eye was okay, and we just let it go. So I don't remember full sight like that, which doesn't faze me much because, like, I don't remember. But since 5 months until February of last year, 2018, I've had 6 corneal transplants in my left eye. And as a result, because of my rare conditions, my corneas will reject a lot quicker. They don't heal normally, following the standard procedure that the average patient can take for having a partial or full corneal transplant. So that means that I have to have constant checking, and I might need to take more or different doses of medication, and have constant testing with that too, which is why I said I bring up my kidneys again, level testing of that, because I took a lot stronger anti-rejection medication than most, sort of like what a standard transplant patient would take. That's not just the eyes. I'd take that kind of stuff, and I'd take high doses of it, and that stuff can affect many of your levels, mentally, your kidney, your arteries. It can affect a whole bunch of stuff. So up until this day, I'm constantly closely monitored. Fortunately, I'm not as severe of medicine as I was then, so the monitoring isn't as bad, but I'm trying to get weaned off of prednisone now, which is what will lead me to the second part of this video. So I think in my memory that I can recall, the most prednisone I've ever taken is 200 milligrams a day, and that meant I took 100 milligrams twice daily. Just to give a list of medicine I've been on in my life, I've been on cyclosporin, which was a medicine that made my levels go haywire. I get sick easily, and I'd have to go to the hospital when I was sick. I had to go on a chicken pox, and I had to get my blood pressure checked portably at home at times. And I just remember spending days while on this medicine in the hospital, where I'd just spend a whole day there off school, and they'd check my IV that was left in for the day 3 times and get tests and samples for that. I get ultrasounds and stuff on my kidneys. So that was basically my childhood. Nice thing is, because it's a children's hospital, I actually don't think too much negatively of these experiences. Like, there's the memories I remember where I was in a lot of pain for being sick, and that still affects me, but I haven't really been as traumatized until the past few years from some procedures, because I'm older and can remember it, and so much has happened. My body's just not taking it as easily anymore. So that cyclosporin made me chubby and hairy all over like a monkey. And I also took a very, very low dose and restricted dose of methotrexate. Now, normally that is a radiation medicine taken by cancer patients. I've always had an oncologist because of these medications I'm on. Transplant patients actually do take this, but as I said, because of what it is, I took it once a week at the same time every week. And just as a precaution, I had to be careful in the sun because of it. But you know me, I'm a bad girl, and I didn't do that too much. So that's another thing I took. and to this day I'm still on mycophenolate. I've tried doing research on it, but I haven't really gotten much out of it, except for the fact that it does affect you as an older woman, and that if you are wanting to get pregnant, you need to consult your doctor first, because you cannot get pregnant on that medication specifically, because you will most likely get a miscarriage, and if you don't get a miscarriage, your baby will probably get some sort of dysfunction of some sort. So I think the highest dose of that I've taken is actually the highest dose that a patient can be on it, which is 3 grams a day. So that was 1.5 grams twice daily. And that was, yeah, that's basically that medicine. And as I will repeat again, I've been on prednisone, and I mentioned that. And I've also had glaucoma drops, and I've even been on a glaucoma med called, what was it called now? I don't even remember what it was called, but it's a pill that honestly makes you feel sick. And I had to take it when they removed my one valve in my left eye and replaced it within 10 days due to an emergency surgery that was needed, because my eye skyrocketed in pressure. I had to go to the ER. And so in the meantime, I was on that medicine, and I had to stay on it after the replacement of the valve, because they had to stitch the top of the valve with a dissolvable stitch, so that as it slowly dissolves, the eye can slowly use the valve instead of just instantly put shock to the eye and go, there's a valve in there now. Oh. So that's what happened. And that medication makes you feel sick to the stomach, low energy, and all that fun stuff. I won't get into the details but of how I felt, but it makes you vomit if sometimes, or diarrhea and stuff like that. So if you get that from taking a glaucoma medication of some sort, that's normal, but if it gets excessive, as all precautions say on websites you look up, go see your doctor. And don't worry, I had to do that too. Like when they removed the valve to begin with, they gave us the emergency number for the doctor, and we actually had to call it, and that's how I got my emergency surgery to get one put back in. So I hope this video is being informative so far. Some of you have probably already fallen asleep and clicked off. I hope that I'm able to keep some of your attention this far, for any of you who might be transplant patients or going through these medications. So now, for sure I mean it when I say I'm getting to the prednisone part. And as I had said, I've been on 100 milligrams, not grams, milligrams twice daily at the most. And now, for the first time in my life, we're actually attempting to wean me off, because I've never really had the chance. So there's a lot of things to prednisone, and I will show you first off what it can look like. So right here is a bottle of the 1 milligram tablets. That's the smallest you can get. And I also have, they're like maybe about this tiny. And then I have the prednisone eye drops. And I have the prednisone 5 milligram as a safety precaution. The doctor had said if I get ill, then I need to increase my dose for 2 to 3 days during the weaning process. So if I start to get sick or something, then I just need to go up to 10 milligrams a day just for 2 or 3 days. And then as an emergency, I have the needle. Yes, it's a steroid pump, and I take this and I put it into the part of the needle, like the back part of it, and I would inject it if I were either severely ill or I would give it to doctors to put into my IV if I was having a surgery. So that's a steroid boost. And those are the forms that prednisone can come in: oral, drops, and an injection. Fortunately, I've never had to take the injection. It's just a safety precaution while weaning off my prednisone. So when you're on a high dose of okay, what is prednisone? It's a corticosteroid. And a corticosteroid is basically, in its name, it affects your cortisol levels. And cortisol is the hormone in your body that affects your stress levels and stuff. Those of you who took psychology, you'll know a lot about cortisol. And when you're on a higher amount of prednisone, this will make you hungry all the time. You're going to gain weight. It affects you mentally. You can get depressed, or it can just help assist in gaining a mental condition of some sort involving depression. And it affects your hormones. So for me, I don't get a regular menstrual cycle. It's never been regular. I can never predict it. And it affects your joints. And as you get older, like not too much older, if you're a woman and you're like a teenager to a young adult sort of age, you can get a chance of getting a bone disease, which will affect your joints. Your doctor can tell you more about that. And it means that you would have to get something sort of like hip replacements or stuff. If you start feeling joint pain, you need to tell your doctor so you can get x-rays right away on that, because it's not something that is refixed. It'll be irreversible, so it's good to deal with it in time. And that is actually what my doctor made a mistake in doing, though. I was starting to get joint pain last year, so he took x-rays and he said they're fine. I look fine, but he wanted me to get off as soon as possible because he didn't want to risk it. And up until that point, he'd been really good with me. He's a great doctor. I can't say anything bad about him up until this point. I had him all my life. And he took me off cold turkey. I was on 10 milligrams at this point. And just a couple months back, I was on a temporary steroid boost because of my surgery. I had my 6th transplant. I had been on 25 milligrams twice daily for 1 week, 15 milligrams twice daily for 1 week, and then I went back to my regular steady dose of 5 milligrams twice daily every week until later notified. So I was at that point a couple months later, and he took me off cold turkey. And let's just say, if you ever need to get off prednisone, you need to wean. Don't ever go off cold turkey. I already mentioned what prednisone is like on a high dose, so I'll tell you what it's like when you're not on it anymore all of a sudden. It doesn't matter how long you've been on it for. If it's been 3 or 4 weeks, doesn't matter. You can still get withdrawal. You need to wean. And it becomes more critical when you're at that 5 milligrams twice daily stage. So for me, I got terrible headaches for the next few weeks. My whole body hurt, all my joints. Like, it took so much effort for me to get off the bed and move and crouch. Like, I had a job at a pizza place at that point, so I'd have to crouch down in the cupboards to get stuff. That was very painful. And you'd also get really tired easily, well, at least I did. And yeah, so that's sort of how it goes. And again, it can affect your mental state. You can be depressed. And I got blood work finally 3 weeks later, and I had a very low cortisol count. So I had to see an endocrinologist, and they started the process of putting me back on prednisone, but they put me on a smaller dose than I'd been before. and that was 5 milligrams once a day instead of 5 milligrams twice daily. Which reminds me, another thing about prednisone, no matter how much of it you're on, please ask your doctor if it's possible for you to always take the prednisone in the morning, because I had insomnia for 12 years of my life before I started taking a medication for that, which was also an antidepressant. And because of the cortisol that it produces, it will stimulate you if you take it at night, and it keeps you awake. And I didn't know this until last year, so I always took the new smaller dose of 5 milligrams in the morning. So that's another effect of prednisone, no matter how much you go on. And if you go on lower doses of prednisone while you're weaning off, you still have the risk of some of those symptoms I mentioned, but not as bad. Oh, speaking of which, I also had a loss of appetite when I was off cold turkey, and I lost a lot of weight because of that. Yeah, because my appetite is completely gone and I didn't have any sort of coping strategies for after that traumatic experience. I think I lost I went from 59 to 47 kilograms within the next 3 months. But don't worry, I'm having people help me out with that, and I've been able to gain a few kilograms back. So that is my experience with prednisone, and my doctor finally gave them the thumbs up, the endocrinologists, for weaning me off of it. So she gave me the choice. I can either go down 0.5 milligram bi-weekly or once a month. So I chose once a month, so right now I'm at the 4.5 milligrams, and so far I'm not dealing with that badly. And then I'll go down to 4, and then 3.5, and then 3, and we'll hope that I can continue doing that till I'm off. And no, I'm not sweating because of the effects of prednisone, because yes, you can get sweats from prednisone as well. Another one of its side effects. It's warm out. So yeah, that is basically my experience. Some more tips about it. If you ever have any issues or concerns about it, you can discuss it with your doctor. There are other routes depending on what your condition is besides prednisone. I would recommend that if anyone doesn't need to take it, then don't take it. Look into your condition first. Bring up the resolutions with your doctor that you could make, and then decide from there together what you think is best for your body, because prednisone is over prescribed, and I know even a few friends who took it that didn't need it because the doctors didn't diagnose them properly, and doctors just throw around this prescription of prednisone to everyone, and seriously, it affects you a lot. To this day, I do have mental health issues. I am severely depressed and I have to deal with that, and I am having issues trying to find a psychiatrist of some sort, but I would like to have a proper diagnosis from a doctor that knows what they're talking about, because I do know for a fact it has changed me mentally, because ever since I went on that really high boost of 100 milligrams twice daily for a couple weeks or more, my mind has never felt the same since. It was like a switch, and that was in 2012. And it's hard for me to describe to people why I am the way I am, and it's sometimes frustrating. And I wish I could tell them I'm doing my best to be happy, but for those of you who have depression, I guess you understand how that feels. But this isn't supposed to be a negative video. I'm just stating facts out there because I'd love to help anyone in the prednisone taking community or transplant community. And for any other information you'd love to know, or me make a video on, let me know, and I can do that. Bye.